welcome, ladies and gentlemen, to today's tutorial. And today we want to begin our journey in the neck region. We've already seen, the pharynx and of course the larynx, which are related to the neck. And today we want to look at, the triangles of the neck, which are of clinical significance. Of course, if you look at, your neighbor's lateral view of your neighbor's neck, you realize that yes, of course, the neck will have a quadrilateral outline, four-sided, outline. But this quadrilateral outline will actually be divided into two main triangles by way of this muscle, which is over here, which you will get to see, that's the sternocleidomastoid muscle. Yes, of course, when I contract it, we're able to see that now we are able to divide, the neck into two main triangles, an anterior triangle, and of course, a posterior triangle. We also bring in some picture of clinical, aspects, which of course we call it torticollis. Torticollis, which the lay person will call it, the right neck. The right neck, which of course in that situation these neck muscles, especially the sternocleidomastoid muscle, is contracted, and therefore rotates the head and neck to the opposite side, and of course turns it inferiorly. So without wasting my time, yes, let's look at these ones. We also bring in the strap muscle, the infrahyoid muscles, and of course the suprahyoid muscles as well. All right, now by way of introduction, we are going to have this area, which is the body of the mandible, which is related here. Then this is the genu of the mandible, with the genial spines inward or in the inner aspect. We're also going to have this muscle, which is the most superficial muscle, yes, in the neck region, which is known as platysma muscle. Platysma. Now it's actually having a subcutaneous origin. This platysma muscle is having a subcutaneous origin, yes, all the way to from the clavicular region below the clavicle, and of course supraclavicular region, yes, all the way to the lip area. So the perioral area will have that insertion around this area. So that's the platysma muscle. Yes, usually when it contracts, then you see some wrinkles, in the neck region. Now, one thing is that this platysma is going to form most of the roof of the triangle that we are going to talk about. So get to know it's forming actually the roof is covering it, most of the triangle, as well as the subcutaneous tissue, and of course the superficial fascia. Of course, these ones are going to contribute to the formation, to the roof of this triangles that we have. So that's the platysma. Now, the next muscle which I want to introduce is this muscle, which is having a very large, from a very large origin. Now, it's actually a triangular shaped muscle, but if both sides are present, it appears, quadrilateral or diamond shaped, and that gives its name trapezius muscle. Trapezius muscle. Now, this trapezius muscle is actually going to originate from the occipital area, actually the external occipital protuberance, yes, as well as the medial portion of the superior nuchal line. The medial portion of the superior nuchal line is going to be related to it. Again, there's a ligament in the midline posteriorly. We are having the superior nuchal line. The ligamentum nicae. Then of course all the spinal processes of the thoracic vertebrae, or the spinal processes of all the thoracic vertebrae will be related to it. Then of course it's going to insert in the clavicle, the upper margin of the clavicle, as you can see, upper border of the clavicle, as well as upper border of the spine of the scapula, as well as of course the acromion process of the scapula, and of course also will have some attachment to the lateral third of the clavicle. So this one will be trapezius muscle. Now this trapezius muscle, yes, is actually going to be having a sensory supply from C3, C4 ventral rami, yes, of the cervical nerves. But of course, its motor supply is actually coming from the spinal accessory nerve, that's the cranial nerve 11. Spinal accessory nerve, that's cranial nerve 11. So we look at that one. And we also have another muscle over here which runs obliquely actually from where we are having two origins actually. Yes, it's going to have two origins, which one of them is going to come from the clavicle. So it's going to have a clavicular head which orients laterally. Clavicular head is also going to have a sternal head, which is of course related to the mandible, sternal head, and therefore we call it sternocleidomastoid, because they are going to help insert in the mastoid process, even as well as the lateral portion of the superior nuchal line. So certain in the mastoid process. So that is what we are going to find. So these muscles are very important. We've seen the platysma, we've seen of course the trapezius muscle, we've also seen the sternocleidomastoid. Now this sternocleidomastoid, we will talk about it, is going to help us divide the neck, actually into two main triangles, which we are going to look at pretty soon. But this sternocleidomastoid muscle, when it contracts, then what happens is that if just one side contracts, you're going to have two. If just one side contracts, then it causes contralateral rotation of the head and neck. So if this one contracts, then it rotates the head and neck to the opposite side. So that's what happens. But if both contracts, then it tends to depress the neck. So that is the sternocleidomastoid muscle. Again, it's also going to have some supply from what we call the spinal accessory nerve. Now, if this muscle becomes contracted, which will actually be, congenital or acquired, then it's going to lead to a condition that we call it torticollis. And this muscle will remain contracted. And this is the case, it tends to, rotate the head to the opposite side, and of course also, depress it inferiorly. So that's what is going to happen. That's torticollis or wry neck that we find. Now, we have some other muscles that are, of course, which will be important that I mention. This muscle, which you find over here, is known as Splenius Capitus. Inferiorly, we will call it, Splenius cervicis, which is related to the neck. Capitus has to do with the head. And of course, over here we have what we call semispinalis muscle. They are going to be related to one of the compartments of the neck, which we will look at pretty soon. Now, apart from these ones, there are some other muscles which are very important that we mention. These muscles are going to be this one, which we call it the scalenus anterior muscle, scalenus medius, and of course scalenus posterior muscles. Of course, between the scalenus anterior and posterior will emerge the brachial plexus from this area. Now, some other muscles which are relevant that we mention is going to be what we call the strap muscles, as well as the suprahyoid muscles. Now, there are some muscles which are related to the hyoid bone. This is the hyoid bone. We've already seen that this is the body of the mandible. Then this is the genu of the mandible. Yes, we've seen that this is going to be this is going to be the thyroid cartilage. And of course, we're also going to have cricoid cartilage in there. So which of course we've already seen them. Yes, this is actually the thyroid gland. Later we look at that one. Then of course this represents the tracheal rings. Now, if we look at it, there are some muscles which are related, to what we call the hyoid bone. So if they are related to the hyoid bone superiorly, then they form what we call suprahyoid group of muscles. Now, if they are related inferiorly to the hyoid bone, they will call them infrahyoid muscles. So each of them, whether suprahyoid muscles or infrahyoid muscles, they are 4 each. Now let's look at the suprahyoid muscles simply with the mnemonic, SMUDGE, SMDG. So SMUDGE will help us, to mention these suprahyoid muscles, and they are going to start actually from here. There is a muscle which actually originates from the styloid process, of the temporal bone, all the way to what we call the hyoid bone. So this muscle that you find over here, this muscle is known as, this muscle which you find it here, which is medial to this muscle actually. Yes, as you can see, this muscle, which is the anterior one, is known as the hyoid muscle. Stylohyoid muscle. It's over here. Now, because it's related superior, it's one of the suprahyoid muscles. Now, the next muscle that's the M, so S for sterohyoid muscles, much, and M is going to be what we call mylohyoid muscle. The mylohyoid muscle, yes, you are going to find it here. Mylohyoid muscle, which of course below it we are having this submandibular gland. So this is the mylohyoid muscle having attachment to the mylohyoid line of the mandible. So that's one. Then you go to, of course, D, and D is what we call the digastric muscle. The digastric muscle. Now this is the digastric muscle. So this is the anterior belly of digastric muscle. Now the name is digastric. Di means two, and gastric has to do with the stomach. So it's having two bellies. So it's going to have what we call an anterior belly, and of course it's also going to have a posterior belly, which is related posteriorly or posterolaterally to what we call the stylohyoid muscle. So there's the posterior belly of the digastric muscle. They will be connected almost at the midline by what we call an intermediate tendon. It will be related, yes, at an intermediate tendon, just lateral to the midline, an intermediate tendon. And what happens is that, yes, this posterior one will get all the way to actually have some insertion around where we have the mastoid process, around where we have the mastoid, related to the mastoid process. So that is what we call the posterior and anterior bellies of the digastric muscle. And the next one is G. So smudge, the G is going to be geniohyoid. So for geniohyoid, this is the genu. So genu of the mandible. So geniohyoid all the way from here to here. So this is the geniohyoid muscle, and this is one of the suprahyoid muscles. So we've seen the four suprahyoid muscles, which are of course the stylohyoid. Yes, we've seen the mylohyoid. Yes, we've also seen the G is the digastric, and then of course G is going to be the the geniohyoid, from the genu of the mandible to the body of the hyoid bone. Now this one that you find over here, yes, this one you find over here is actually related to from the genu to the which is deep to this geniohyoid muscle. Is deep to the geniohyoid muscle. Therefore we call it it's related to the tongue. Therefore we call it genioglossus muscle. It's not a suprahyoid muscle. Again, there's another muscle over here which of course we have to mention. It's also not a suprahyoid muscle, although it's having attachment to the hyoid bone. To the hyoid bone, actually to the greater horn of the hyoid bone. That muscle which you find over here is what we call also related to the tongue, and therefore we call it hyoglossus muscle. So we've seen the four suprahyoid muscles. Now for the infrahyoid muscles, there are also four, and they can also be referred to as a strap muscle because of how the vertical orient, how flat they are, the strap muscles. And these strap muscles are also four. So simply with the mnemonic TOS, TOS will help us remember these infrahyoid muscles. So T is going to help us for T. So that's the thyrohyoid. So TOS. So you have related to the thyroid lamina of the thyroid. So thyrohyoid muscle. So TOS. O is what we call omohyoid. Now omo has to do with the scapula. So all the way from here, the omohyoid is also having two bellies, a superior belly, as you can see over here, having an intermediate tendon and an inferior belly, relating to actually the superior angle actually of the scapula. That is the omohyoid muscle. So having an inferior belly and of course a superior belly of the omohyoid. So that's TO, omohyoid. Now we have two S. So the first S is this one. So from the sternum, so stenohyoid muscle. Stenohyoid muscle. Stenohyoid muscle is another, infrahyoid muscle. Stenohyoid muscle. And there is, another one which is called stenothyroid muscle. Stenothyroid muscle. Yes, stenothyroid is not really related, yes, to this hyoid bone, but of course, because it's found below, the hyoid bone, we can still call it an infrahyoid muscle. So that's stenothyroid. So from the thyroid, bone all the way to the body, a mandible of the steno. So stenothyroid muscle. Stenothyroid muscle. So these are the strap muscles, yes, suprahyoid muscles and infrahyoid muscles, which we've seen. Now, we said that by way of this muscle, we're able to divide, the quadrilateral shaped, neck, from a lateral view into two triangles. We are going to have, yes, so this is what we call the sternocleidomastoid muscle, dividing, the neck, lateral view of the neck, into actually two triangles. You have an anterior triangle and of course a posterior triangle. Now, if you look at the anterior triangle, then it will be bounded actually, posteriorly by the anterior border of the sternocleidomastoid muscle, So as you can see, and then it will be bounded, anteriorly, anteriorly by what we call the midline rapid, or of course, the median plane running through the neck this way. And superiorly, it will be bounded by actually the body of the mandible, as well as an imaginary line drawn from the angle of the mandible to the to the mastoid process. So we complete this triangle. So this is the anterior triangle. Now the posterior triangle will therefore be bounded anteriorly by the posterior border of the sternocleidomastoid muscle, and then of course posteriorly by the anterior border of the trapezius muscle. This is the trapezius muscle. And then of course inferiorly by the clavicle, by the superior border of the clavicle, all bounded inferiorly. That would be the inferior boundary. So we have into the two triangles. Now these triangles also have sub-triangles. Now these sub-triangles for the anterior triangle is going to have 4 of these triangles, simply with the mnemonic CSM. Cerebrospinal meningitis can help you to know all these triangles of the anterior neck, sub-triangles of the anterior triangle. So CSM, there are 4 triangles, only that the S, 2 of them, which we'll look at, and then the posterior triangle we're going to have just 2 triangles. So let's look at the anterior triangles. Now for the anterior triangles, we are going to find this triangle, which you find it over here. It's a small triangle, which is actually found over here. Now this area represents the anterior triangle, Therefore, this anterior triangle is bounded, yes, laterally by what we call the upper part of the anterior border of the sternocleidomastoid muscle over here. And then anteriorly it will be bounded by the lateral border of the superior belly of the omohyoid muscle, and then of course superiorly you will join it, yes, over here superiorly you can see these muscles, the posterior belly of the digastric muscle, as well of course the stylohyoid muscle will be related to it superiorly. So this area, this is the carotid triangle. So I say CSM, yes, so C for carotid triangle, and this carotid triangle is the most important triangle of the neck, because there are some important vessels over here, which of course if there's a stab, one is stabbed around this area, then the person is likely to die from losing great deal of blood. Now, importantly, because you are calling it carotid triangle, then the important thing is that it will be related, found within it will be the common carotid artery. Now, at the level of the superior border of the thyroid cartilage, this carotid artery will divide actually into two. It will divide into what we call the internal carotid artery, and then it will also divide into what we call the external carotid artery. Now, either around just at the point where it's going to bifurcate, or even on the internal carotid artery, we have what we call carotid sinus, and this one has baroreceptors actually for helping regulate, detecting changes in blood pressure. Now, importantly, so it means that we are going to find some internal carotid artery will be related, yes, as well as some branches of the external carotid artery. Notably, we are going to find, yes, this one which runs this way, getting the thyroid gland, which is the superior thyroid artery. Again, we have another one which pierces through this thyroid or thyrohyoid membrane, which pierces through it. That's the superior laryngeal artery. Then, of course, we also have another one which will go to the tongue, which we will call it the lingual artery. Then, of course, we also have another one which will actually run this way. It's the facial artery. So these ones are some of the contents of the carotid triangle. But of course, even in addition to this, we are also going to have the vagus nerve, yes, as well as the cranial nerve 11, which is the spinal accessory nerve. Now, one thing that is important that we mention is that the carotid, common carotid artery, as well as of course the internal carotid artery, yes, together with the vagus nerve, they are actually content of the carotid sheath. Yes, in addition to these ones, we're also going to have what we call internal jugular vein, which will be lateral to the common carotid, lateral to it. That one we also have it as a content of carotid sheath, as well as content of this carotid triangle. So that's what we are going to find over here. Now, the next one, which is one of the triangle, the next triangle that we want to look at will be this triangle, which we'll call it over here. Let me use this one first. Over here will be another triangle, which we'll call it submental triangle. Well, some books will also call it suprahyoid triangle, but commonly we call it submental triangle. Therefore, this submental triangle will be bounded, yes, medially by the midline, and of course laterally by the belly, anterior belly of the digastric muscle, and then of course at its posterior aspects will be bounded by what we call the body of the hyoid bone, giving us this triangle. So that's a submental triangle. So of course, in the submental triangle, we are going to find, of course, submental lymph nodes. Submental lymph nodes will be present. Yes, in addition to this, there will also be some branches of the facial nerve. Facial nerve will also be related to it. Submental triangle, some branches of the facial nerve, as well as of course facial vein, some tributaries of the facial vein. So these ones represent actually what we call the submental triangle. But of course, that the floor of the submental triangle will be related to this muscle, which we call it the mylohyoid muscle. The floor will be related to the mylohyoid muscle, which we have seen here. Now, the next triangle which we are going to see is related here. There's another triangle, as you can see. This triangle is known as submandibular triangle. Now, it's going to be bounded, yes, by, of course, the body, so laterally by the body of the mandible, of course, medially by what we call the anterior belly of the digastric muscle. There's a digastric anterior belly, and then posteriorly by what we call the posterior belly of the digastric muscle. So this triangle that we find over here, yes, of course, as well as an imaginary line which we draw from the body all the way to the mastoid process, so giving us this triangle. So this triangle, because the digastric muscle is an important part forming this triangle, then we also call it the digastric triangle. You can also call it the digastric triangle. Yes, of course, the stylohyoid muscle is also related to it, at its lateral aspect. So that's what we find with the digastric triangle or the submandibular triangle. So of course, importantly, we are going to have the submandibular gland, which you can see here. Of course, some portion, inferior portion of the parotid gland will also be here. Apart from this, yes, we're also going to have the facial artery. Facial artery also be related to, of course, facial vein also accompany it. Then, in addition to this, we also have the hypoglossal nerve, the cranial nerve 12 also related to it. So that is the submandibular triangle, submandibular triangle. So essentially, that's what we are going to find with these triangles. Now, for the anterior triangle, now we go to what we call the posterior triangle. For the posterior triangle, we are going to have just two main triangles, which you can see here. And these triangles are actually formed by the inferior belly of the omohyoid muscle. Is dividing the posterior triangle into a larger superior occipital triangle, because related to the occipital bone, and of course a smaller one which we call it the subclavian triangle, or supraclavicular triangle, because on top of the clavicle. Now let's look at the larger one. So the larger one laterally, with the anterior triangle, there is another triangle, because say there are four. He said, simply with the mnemonic, CSM. Now the last one is the muscular, M for muscular. This is the muscular triangle. Now the muscular triangle, it actually is, this content is going to be the infrahyoid muscles, mainly the strap muscles are going to be there. So it will be bounded, yes, laterally by the posterior border or the lateral border of the superior belly of the omohyoid muscle. Then of course at the midline anteriorly, it will be bounded by the midline, and of course at its lateral parts, it will be bounded by the inferior portion, the medial border of the inferior portion of the sternocleidomastoid muscle. But of course, this muscle, yes, you can say that superiorly it will have some boundary with the hyoid bone, body of the hyoid bone. So it's not really giving us a real triangle, not really giving us a real triangle. So that's a muscular triangle. So its content, is going to be these infrahyoid muscles. Of course, you can see the superior belly of the omohyoid muscle. You can also see, yes, the sternocleidomastoid muscle. You can also even see the sternothyroid muscle. Yes, even apart from that, we will actually be able to see this one as well, which is the hyothyroid muscle or thyrohyoid muscle, being content of this muscular triangle, this muscular triangle. So that's what we are going to see over here. Now, the next thing that we will look at is the posterior triangle, which we already started. This posterior triangle, so superiorly, we are having this triangle, which is known as the occipital triangle, because related to occipital bone. So it's going to have its apex related to the occipital bone over here. So you're going to have the anterior border, anterior border of the trapezius muscle, forming one of the boundaries laterally. Then of course medially we are going to have the superior portion of the sternocleidomastoid muscle, posterior parts from the boundary. Then the superior border of the inferior belly of the omohyoid muscle, forming its inferior boundary. So we have this triangle. Now this triangle is the occipital triangle, and importantly, we are going to have of course cranial nerve 9 in there. We're also going to have the cervical plexus also related here, and of course even the brachial plexus. Some of the portions of brachial plexus will be related here. Will be that. Of course, we can see an important artery which is coming out over here. That is the occipital artery, which is actually a branch of the external carotid artery, which is also a content of this occipital triangle. Now this lower level, which will be bounded superiorly by the lower border of the inferior belly of the omohyoid muscle, then of course the lower portion of the sternocleidomastoid muscle, as well as, so that will be the anterior border, as well as the superior border of the clavicle, medial aspect of the clavicle, will form the boundary of this triangle, which of course the content are the carotid artery, of course, and of course the carotid vein. As a result, we are going to call it are the subclavian artery and of course subclavian vein. And so these triangle will be called subclavian triangle or supraclavicular triangle. So that's the smaller triangle of the posterior triangle of the neck. And actually, yes, even some trunks of brachial plexus will also be related there, as well as some lymph nodes as well. All right. Thank you very much. I hope this video is going to be helpful to you, for your audience. Thank you. Yes, so as part of the content of the occipital triangle, we are going to have the semispinalis, the Splenius Capitus. We're also going to have what we call the posterior, middle, and then anterior scaling muscles as well. So these ones will also be the contents of this superior or occipital triangle.